A time for change, to unmask the truth, to unmask the rot in our communities. Unmasking the Truth will focus on the effects of corruption on women, prefer solution and demand for accountability. Unmasking the Truth will be on this radio station every first Monday by 5:30 p.m. And we ask you to join us to condemn corruption, to demand for accountability, and to work together for a better Nigeria. Unmasking the Truth is an initiative of St. Ives Communications in partnership with Voice of Women and supported by the MacArthur Foundation.
All right, you're welcome to another episode of the program Unmasking the Truth. Today, Monday, the 4th of November, 2024. All right, so today on the program Unmasking the Truth, we'll be looking at improved primary health care centers for pregnant women in Ibafo, Ogun State. Today, we are happy to unmask the truth on improvement in the quality of care provided at the primary health care center in Ibafo, a rural community of Ogun State. In our previous reports, we highlighted the impact of poor healthcare services on pregnant women in Ogun State and how they struggled with inadequate care, absence of essential drugs, and poorly trained staff, with attention from both state and federal government, alongside efforts from Women Radio 91.7 FM through media advocacy. Ibafo women are now reporting slight improvement in the quality of care provided at their primary health care center, Ibafo. Women told us that they are now being attended to by skilled healthcare workers, that they are using better equipped facilities, and that they have access to more essential medical supplies. Now, the pregnant women in the Ibafo community of Ogun State told us that they are beginning to experience safer and more reliable healthcare services during their pregnancies. Unmasking the Truth is an initiative of St. Ives Communications in partnership with Voice of Women and supported by MacArthur Foundation. I am Rose Yusuf Kaisar. And of course, I'm happy to be here to talk about the improvement in this particular primary health care center. I mean, I've been to some primary health care centers in Ogun State, and I would say that, yes, there has been some improvement compared to what was obtainable last 3 years or 4 years. All right, so there has been some level of improvement, and we are definitely, happy to be part of this improvement that has happened in different primary health care centers, especially around us here in Ogun State. Unmasking the Truth on your radio station today have pregnant women as guests to tell us their stories of improved care from the Ibafo Primary Health Care Center in Ogun State. Now, in a community where women once faced poor health care during pregnancy, changes are being experienced, and women are reporting better service delivery at their primary health care centers, healthcare center in Ibafo, especially in Ibafo, Ogun State. Now, we spoke to some of these pregnant women in Ibafo, and they shared their personal experiences on the improved care. All right, so we're going to be talking about, we're going to speak to one of them right away. Her name is Aisha, and we're going to hear about some of the changes that has occurred, and maybe her experiences so far, because I know that for a lot of women who have gone to that primary health care, they have had one bad experience or the other. Are we talking about how they've been attended to? Are we talking about the medical supplies? Are we talking about the environment of these primary health care centers? How good were the environments? Even after giving birth, what's the care like? Do you just give birth and they tell you, well, you just come and go because we need to use the bed for somebody else? How were the nurses treating you? Were there even enough hands to actually take care of you? Because when you don't have enough hands in hospitals, then you find out that the little hands that are available might not give you all the attention you need, and by the time you're stressed, they tend to just ease that stress out on you just to find a relief for themselves. So, I mean, for us to sit down here today and talk about an improvement, especially in Ibafo Primary Health Care Center in Ogun State, it's something worth talking about. And even, aside Ibafo, Even in Mowe too, the primary health centers that I've seen, in Mowe, I think there's one in Mowe Market and there's one close to the Oba Palace. They actually look good. They look better than, they were before. So yes, let's just go ahead and hear from Aisha. Let's hear what Aisha had to say as regards her experience and of course some of the changes that she might have experienced.
Tẹ́lẹ̀ mo máa ń lo Ibafo health care center àmọ́ wọn ò ní ìtọ́jú tó péye rárá. Àwọn nọ́ọ̀sì wọ́n ṣe máa ń báyàn sọ̀rọ̀ wọ́n kàn máa báyàn sọ̀rọ̀ ṣá wọn tún ní fún wa ní àwọn oògùn tó péye bí mo ṣe lọ sí general hospital nìyẹn tí mo lọ bímọ sí àmọ́ ń sìn mo ti lóyún mi mo ti padà síbẹ̀ wọ́n dẹ̀ ti ń ṣe dáadáa wọ́n ti ń ṣe dáadáa.
Okay, so, just for those who don't understand Yoruba, all Aisha said was, I used to avoid the health center because they lacked the basic things we needed. No drugs, bad maternity beds, even attention from the staff was rude with no emotions. But now the center has more supplies. The nurses are kinder and even more attentive. And I no longer need to travel far to get good care. And this is the improvement that we are talking about. All right. It's actually a thing of pride for us to sit down and talk about this particular improvement, because you can imagine how far a pregnant woman would have to travel, have to go just to access good medical care that could just be brought, to her around where she stays, that she could just easily probably trekking or maybe just take a tricycle or maybe, a bike and she's there. So it's not much of a distance. So this is definitely a good improvement. And I'm also hoping that in other parts of the states, this is also the same story. But for the health center that we're looking at today, we're looking at the Ibafo Primary Health Care Center here in Ogun State. So I'm just hoping that every other part of Ogun State has taken, cue from this and the government has done the needful. All right, in the meantime, let's go ahead and hear from more women. Let's hear their experiences with the Ibafo Primary Health Care Center.
As woman we get belle, I've been the use health center, Ibafo Health Center, since I get belle. And the place, and they try, since I get belle, then they try. Nothing like, say, injection all day, when I supposed to collect injection. They get one injection where they give us, they call an... What's the name of that injection, self? Tetanus, tetanus injection. They give us no time where I don't collect two now. The first time where I collect, nothing like say the injection don't finish. I be the routine drugs where they give us. Nothing like say it don't finish. And the people where they work for there, they try. They show us love. They show us that they make us feel happy anytime we go there. Even if person they think come up for house because of how this condition be, if we go for this thing, maybe they go for checkup every time I go. Anytime I return, when I go there like this, I come back house. They always stay happy because they could give us lectures, tell us everything we were supposed to know, how we supposed to eat, what we supposed to eat, and what we not supposed to eat. They lecture us, tell us everything, all the things we will need. As person we get belle, they told us and they teach us everything, how to take care of ourselves, everything to expect when our pikin they come. Then they try for health center. God bless them for health center.
Of course, you can definitely hear it from her voice. You can hear it from, from her expression. She is definitely thankful for how far the Ibafo Primary Healthcare Center has come. She's excited and she's happy that she's getting all the attention she needs. All her routine drugs are being given to her. So there's no need for you to start running helter-skelter or miss a particular drug just because one is not available, or miss the immunizations you're supposed to be given because one dose is not available, all of that. So yeah, this is definitely, an improvement that we are all happy about. As long as our pregnant woman is safe, as long as the baby is also safe and is doing well, is kicking well, then I think we're all going to be happy, because at the end of the day, this is definitely saving the life of the mother and saving the life of the child, because once a woman is pregnant, we just want to make sure that up all till she gives birth, she is healthy and the baby all is doing well, and at the end of the day, we have both of them go home safe and sound in a conducive environment where all they need is being given to them, and all the drugs that they need is being given to them, all the care and attention they need is definitely given to them. So let's go ahead and hear more women speak about their experiences at the Ibafo Primary Health Care Center.
Gaskiya ni dai na ba zuwa asibitin karkara saboda rashin kula. Muna shiga cikin gari babba asibiti ta koyarwa, saboda karkara kana iya zuwa asibiti ka isko ga mutane sun yi gashi ba ma'aikata ga dai rashin kula. Shi yasa dai gara mutum ya hito ya ta asibitin gari, asibitin koyarwa yadda mutum zai samu kulawa. Gaskiya mu dai mun bar asibitin karkara saboda rashin kula.
To, wato ni dai tun cikina na farko da na je Ibafo Primary Health Care Center. Lokacin su nurses ɗin su dinga ma mutum magana duke da sun gan dama, su wasu magungunan ma babu. Wani lokaci ma suka je kai ta zama a wurin ba wanda ma zai baka ansa. Gashi ko asibiti makaran kan shi ba wayan gina shi da kyau bane, ko da shike an gina, amma wasu wurare gashi nan dai ba, in ka shiga wurin ma da kyar ka iya ka gane wai asibiti ne. Su nurses din ma ba wai suna ansa mutum da ya kamata ba, su yi maka ihuwa na su ce maka tashi nan ka je can. Amma dai yanzu gaskiya akwai improvement. Ciki na biyu da na je wurin, na je na gan an canza nurses, kuma wani da suna wurin har suna dariya da mutum, suna ce maka za su gaya maka welcome, za su shiga da kai ka yi da ya kamata ka yi antenatal naka, ka karba magunguna lafiya. Gini din ma duk an canza, komai dai yayi kyau yanzu, gaskiya ya fi yanda yake da, kuma irin service din da suna bayarwa yanzu duk ya fi yanda aka yi da, because ciki na farko gaskiya har na ce ma mai gida na ni ba zan sake dawa ba, amma na biyu nan da na ji wata mata tana ce wai kamar fa an kawo wasu mutane sabobi, wasu nurses sabobi, shi na ce to bari in gwada mu gani, kuma tun da na fara zuwa gaskiya ina jin daɗin zuwa wurin, abun ya fi yanzu. Na gode ma gwamnati da sun sun caccanza abubuwan nan, da duk wanda ma sun sa hannu su caccanza abubuwan nan. Yanzu services nasu is very very much better, da abubuwan da suna yi, su magunguna ne, yanda ma suna magana da mutane, yanda ma suna kula da masu ciki. Gaskiya ni kam ya fi mu yanzu. And kuma gaskiya yanda ake yanzu da health na masu ciki, yanda ana bi da su ya fi yanzu, because zai sa mata masu ciki su sake su yi magana da na damunsu, zai sa mata masu ciki su ji daɗin zuwa wurin, kuma zai encourage mata masu ciki su dinga zuwa antenatal, because abun nan yana da kyau ma mata da yawa.
All right, you've heard from different voices of women in different languages, all expressing how happy and satisfied they are, because they're all pregnant women, as it is, like we said at the beginning of the program. We were able to get in touch with pregnant women to share their experiences, especially pregnant women who have given birth there before and who are also pregnant at the moment, and are also planning to give birth at the same Ibafo Primary Health Care Center. We are unmasking the truth on your radio station today with the improvement in care for pregnant women in Ibafo Primary Health Care Center. Unmasking the Truth is an initiative of St. Ives Communications in partnership with Voice of Women and supported by the MacArthur Foundation. Most pregnant women, especially in rural communities, previously faced huge difficulties with basic care at PHCs. However, recent reforms aimed at improving services in these centers have empowered pregnant women, giving them better access to healthcare. This positive shift has not only relieved their anxieties, but has also restored trust in the public healthcare system. All right, so we'll definitely go ahead and hear more from the pregnant women that we were able to get in touch with to share their experiences. All right, so it's one thing for a pregnant woman to actually find herself in a primary health care center where she's not being attended to well, and at the end of the day that might cause maybe one birth defect or the other, or that might put the mother's health at risk, just aggravating all of the health challenges that could come to her. I mean, as little as even going through malaria test, having all of our routine drugs and all of that cannot actually be, given to her, just because maybe there are not enough staff in the PHCs, maybe there are not enough, doctors, gynecologists to attend to them, maybe the environment is not even a good one, so many other challenges that could actually make, pregnant women experience not even a good one. Because sometimes when a pregnant woman sits with another pregnant woman, and maybe the one who is able to go to another hospital is telling the one who has to visit a PHC, telling her about her experiences, and this one is wondering, why do I not have access to all of this that my fellow woman is telling me that she is getting access to? So a lot of these challenges could actually pose a threat to the pregnant women, especially to their babies and even to their own health, even after they give birth, because pregnancy is not just about carrying the baby till 9 months and you give birth. Even postpartum care, how is that done? How are the health personnel helping out to see that the mother is able to transition successfully from the pregnancy stage to the giving birth stage to the postpartum care? Because that is also important. All right, so go ahead and hear, more stories, more positive stories about how improved care at the Ibafo primary health care centers is positively impacting the lives of pregnant women and their families.
Mo ní ìpèníjà ojú, mo ti di olóyún. Mo fẹ́ sọ ìrírí pẹ̀lú primary health care center ní Ibafo. Ìgbà tí mo kọ́kọ́ lóyún, oyún alákọ̀ọ́bí mi, tí mo lọ bẹ̀ fún nǹkan tó ń pè ní antenatal ní primary health care center ní Ibafo. Ìgbà yẹn wọ́n ò ní ẹ̀kọ́ bó ṣe ń dá ẹni tó ní ìpèníjà ojú wò ní rárá àtọ́ nígbà yẹn. Ẹ jẹ́ mọ̀ pé mo ṣe bọ́lẹ̀ láti orí ọ̀kadà níbẹ̀ ní nọ́ọ̀sì ní kí n máa bọ̀. Èmi tí mo ní ìpèníjà tí mo ti lóyún, báwo mo ṣe fẹ́ mọ̀nà dé inú health care center. So wọ́n ní yóò yẹ kó sáré wá bá mi pé kó wá fà mí lọ́wọ́ wọnú ilé gbogbo ẹ̀. Ìgbà tó tún dá mi lóhùn gan, ìdúró bó ṣe ń ṣe, ó kàn ń ṣe test fún mi ni. Ìgbà tó ń ṣe test náà fún mi tán, tó ṣàyẹ̀wò fún gbogbo ara mi, ẹni tó ní ìpèníjà ojú, ó máa sọ fún mi ni, mi ò lè rí. Wàá sọ bó ṣe ń lọ, wàá máa sọ fún mi pé báyìí ni kíní o, nǹkan tí mo rí nínú ìfúnpá yín lélẹ̀, nǹkan tí mo ṣe kíní kan, thermometer yín gbogbo ẹ̀ kò sọ ìyẹn, ó kàn ṣe gbogbo ẹ̀, torí mi ò rí nǹkan kọ́kọ́ dà pé mo dá wà ń bẹ́ẹ̀ ni. Ìgbà tí ó tún wá tán tó mú lọ sí ọ̀dọ̀ dókítà àgbà, kò tún mọ bó ṣe máa fà mí débẹ̀, ṣe ló kàn ń wọ́ mi lọ ni. Èmi tí mo dẹ̀ lóyún tí mo ní ìpèníjà, ó lè wọ́ mi, wàá mú mi débẹ̀ ni, wàá mú mi débẹ̀ ni. So even though ìgbà yẹn dókítà wọn wọ ọ̀kan gbà yẹn, àwọn gbogbo ibi tó máa sùn sí tó máa fi dáyàn lóhùn kò pọ̀ ń gbà yẹn, àwọn nǹkan wọn ò fi bẹ́ẹ̀, ibẹ̀ yẹn kò ṣe ń rí gbà yẹn. Kò sí àwọn nọ́ọ̀sì kéékèèké ńgbà yẹn tó máa ń kọ́ṣẹ́ wọ̀ fi bẹ́ẹ̀ pọ̀ ńgbà yẹn, kò dàbí láì fàtúbà tí mo lè kọ́ pé mo báyàn bẹ́ẹ̀ ni. Tó yẹ pé mo ṣáà rọ́jú nígbà yẹn. Nísìnyí tí mo lóyún lọ́wọ́lọ́wọ́ báyìí, oyún ẹlẹ́ẹ̀kejì mi sìn, tí mo lọ bẹ̀, bí mo ṣe ń bọ́lẹ̀ láti orí ọ̀kadà, nọ́ọ̀sì tó wà ń bẹ̀ táyé wá bá mi, ó mú mi, ìdúró bó ṣe mú mi fat, mo mọ̀ pé wọ́n ti ní ẹ̀kọ́ bó ṣe ń dá ẹni tó ní ìpèníjà ojú lóhùn, tó ní ìpèníjà ó ti ní ẹ̀kọ́ yẹn. Ṣé ló ra mú mi, ló fà mí wọlé. Àwọn tó wà lórí tò ó bẹ̀ wọ́n pé kó jọ kóun dá mi lóhùn pẹ̀lú mo ṣe ní ìpèníjà. Ló dẹ̀ dá mi lóhùn, ló ń sọ gbogbo ẹ̀ fún mi, ló ń sọ gbogbo ẹ̀, ó tún bá mi sọ̀rọ̀. ìgbà tó yá dókítà àgbà tó tún pàṣẹ fáìmì fún ìyẹn náà ọ wá bá mi náà ni lọ́ra mú mi lọ́fà lọ́tún lọ́n ṣáájú mi màdámù ẹ pẹ̀lẹ́ o màdámù ẹ rọra o ẹ ṣe gbogbo ẹ̀ ló tún béèrè gbogbo ẹ̀ bí báwo ni ìpèníjà mi ṣe jẹ́ pẹ̀lú oyún pẹ̀lú gbogbo ẹ̀ wọ́n ṣáà sọ irú oúnjẹ tí máa jẹ tó máa ran ọmọ lọ́wọ́ bó ṣe ń sọ gbogbo ẹ̀ lọ́dẹ̀ ń kà fún mi lọ́dẹ̀ ń sọ pé tí mi ò lè kàwé sáàmì nígbàgbé tí bá délé ó tún bá mi ṣe ní ọ̀nà tẹ́ pé mo lè fi understand ẹ̀ tó máa yé mi ló máa yé mi gẹ́gẹ́. Kò tún ṣe yẹn nìkan o ìgbà tí dókítà àgbà tún dá mi lóhùn tẹ ló tún ra mú mi bọ́ta kò ní kí n máa lọ ò torí ó fà mí lọ́wọ́ ó ra mú mi ó dẹ̀ tún ṣáájú mi tó dẹ̀ àwọn nọ́ọ̀sì tó tún wá ń kọ́ṣẹ́ ti pọ̀ bẹ́ẹ̀ lọ́tún gbogbo ṣáà ṣáájú mi bẹ́ẹ̀ gbogbo àwọn kan wọ́n ti pé sí bẹ́ẹ̀ wọ́n ti wà òkè kò dẹ̀ wọ́n ó jẹ́ kó tẹ́ pé agbára èèyàn lè ka ni títí mo ṣe ń lọ fún antenatal mi wọ́n ti tọ̀wá sí mi gan wọ́n máa ń pè mí wọ́n máa madam àrí ṣé kò sí nǹkankan so in fact gbogbo ẹ ti yàtọ̀ ó ti yàtọ̀ títí tẹ́lẹ̀ pẹ̀lú bí mo ṣe nípèníjà yìí wọ́n ti ní ẹ̀kọ́ àti ìmọ̀ bó ṣe ń dá ẹni tó nípèníjà lóhùn ní primary health care center ní Ibafo.
Good afternoon. My own experience for Ibafo Primary Health Center before, it did very bad. When I first get belle for my first pikin that time, now there I register for antenatal where I dey use. But when I reach there, the way that they take do their things, they go just they look you like say sometimes they go they shout. I say they disturb them, you know. But now, I can't be surprised, say, this my second belle. When I can't start to the go there, I can't notice some changes. The changes where I first notice now from the way where the people where they work for there, they take attend to us. They know they shout again. In fact, they treat us like say we be eggs now. If you ask them question, no be that time when we say if you ask them question, they go they shout like say you they disturb them, abi one thing. But now they go answer you, take their time, explain to you, say for person wey get belle, now this work you suppose they do, you not suppose they do this. Now this kind of food you suppose they chop, you not suppose they do this kind of work, you know. So the mama and the pikin go grow well. They teach us well now when we go for antenatal. Before when we say if we go for antenatal, we could just spend like 10 minutes. They don't do it they want to, we don't come up for there. But now that they take their time, they explain everything to us in total. May we understand the things where we supposed to know as pregnant women. You know, and they enjoy their service now. Forget say the place they cheap, but now I feel talk say they know they different from the normal private hospital where we they see now. That they try where they don't really improve. They don't really improve where.
Right, and these are the improvements that we are happy to talk about today on the program Unmasking the Truth. Now, although we still have communities that lack basic primary health care, the improvements we have seen from these healthcare centers mark a crucial step forward in ensuring that women, especially those in underserved communities, receive the quality health care they deserve during pregnancy. It is also clear that these recent improvements in care for pregnant women at PHCs are crucial for reducing maternal and infant mortality and increasing safer pregnancies. We thank both Ogun State and the federal government for listening to the voices of women and taking the necessary steps. If you have a positive success story on how corruption and lack of accountability has reduced, and especially how women and girls are benefiting in your community, please share with us by text or WhatsApp on 070-317-56537. I'll just go over that number again. You can share with us by text or WhatsApp to 070-317-56537. Unmasking the Truth from the Gender Lens is an initiative of St. Ives Communication in partnership with Voice of Women and supported by the MacArthur Foundation.
Now, thank you to the production team of Aisha Sani and Taiwo Adele, and of course the executive producer Tom Okewale Shunaya. My name is Rose Yusuf Kaiser. Until next time on the program Unmasking the Truth, please do well to keep safe, and of course let's keep sharing some of the stories. And like I said, if you have a story that you want to let us know, share with us on how corruption and lack of accountability has reduced, and especially how women and girls are benefiting your community, just do well to share that with us. All right, thank you very much for staying with us. Do well to stay with Women Radio WFM 91.7. My name is Rose Yusuf Kaiser. Good evening.
WFM 91.7.